Okay, so hello. My name is Raymond Ng. I am a computer science professor and also the director of the Data Science Institute. And I also want to introduce you Professor Anita Palipu, who is the department head of the Department of Medicine. The micro-credential program that we are talking about today is a joint initiative between the Department of Medicine and the UBC Data Science Institute. And it focuses on health data analytics. And we want to take the opportunity, allow you to meet our instructional team later on and find out why we created the program and what you could expect to learn from this program. We have a lot of time to answer the questions that you might have, even though we had a little bit of a delay, but I think we still should have a lot of time. And we're also recording this session and we'll be posting it on our website for future reference. So if for a reason that you don't want yourself to appear in a video, you could also shut down your camera. So before I begin, I should do a land acknowledgement. I am wherever you are, you might be in different parts of British Columbia or Canada. For me, I am now doing this call from UBC Vancouver campus, and in fact, I live on UBC campus for over 30 years. And so I'm certainly feel very privileged that I've been living in the ancestral unceded territory of the Musqueam people, so it has been wonderful for me, personally, as well as many UBC students to be on this campus. We'll be beginning with a brief introduction to our program lead. We will go over why we developed this program, the goals, and the potential career applications of the micro certificate. We'll share the format delivery schedule of the program, as well as some highlights of the curriculum. We are lucky that we have one of our current students to join us, and she has kindly agreed to share her experience and her perspective of the program, which hopefully would be very useful for some of you in deciding whether this is the right choice for you. Before I continue, one last note is maybe please remember to mute your microphone and enter your questions or comments into the chat throughout the session. And one of our teaching staff, Ulia, who not only teaching staff, but she has actually been co-developing a lot of the program. We'll be monitoring the chat today, and then we'll answer your questions after a few slides that I'm going to share with you. Next slide, please. We will also be putting together a short survey to get a sense of who you are and how best we could spend the next hour to address the specific interests and questions that you might have. And so please submit your poll, and we will also be answering your question. So I have already introduced myself. Maybe Anita, you want to say a few words about yourself?
Sure. Hi, I'm Anita Palipu. As Dr. Ng said, I'm the head of the Department of Medicine at UBC and at Providence Healthcare. We took the initiative to develop the Data Science and Health Research Cluster, and this has sort of been the nidus in our interest in developing educational tools for people who are working in the health system to better leverage computational methods and data science to help answer questions with a particular interest in improving quality. And we know there's going to be increasing tools being used, and we're wanting to equip our workforce with this knowledge. Thank you.
Great. And so I've already introduced myself. Maybe I'll just add that the Data Science Institute in the past few years have worked very closely with the cluster that Dr. Pelipu had just mentioned. We have co-developed this micro-credential program, but we also have co-developed other related courses that we provide for the students in the faculty of medicine. So we have a very strong working relationship. Say a few words about the just to give you a overview of the program. So data science, as some of you know, is a very rapidly evolving discipline. When we designed this program, we thought very carefully about the scope of the tools and the skills that we want to put into the program, fully understanding that the purpose of this micro certificate is really aiming for an audience that need a part-time and completely 100% offline opportunity that could seamlessly integrate into your busy lives or into your work life. And I think we are also thinking about that we want a program where we could provide some upskilling opportunity, for some of you. Some of you might already be in the healthcare profession for some time, and maybe you're interested in what this AI and data science and natural language processing, machine learning, what they are for. And so I think the micro credential is really trying to fill that need in providing some basic concepts and for you. So the expected workload of the program is really obviously it depending on how much you know, how much time you have, and how keen you are. But we expected that it will be 5 to 6 hours a week. So on average, it might be 1 hour every day, every night. Maybe you to squeeze a bigger chunk of time over the weekend. But we also want to have some synchronous discussions and office hours for the learning experiences. So I think, Steph, we are still talking about slide 6. So if you say, oh, I want to talk to the instructor about this, I want to get some more clarification on the assignments, and maybe the discussion board is still not sufficient for that. And so you want to talk to a person live. And so this is why we organize a synchronous, discussion, session for you. Now, in terms of the courses, and I'll say a lot more about them, later on, is that the courses are really standalone. I mean, there are 3 of them. Course 1 is Introduction in the Big Data Era and Opportunities. Course 2 is Health Data and Visualization. And then Course 3 is Health Data Analysis and Machine Learning. So they are supposed to be standalone, and they could be completed in any order. But it's recommended that to complete it in a sequence if you want to get the micro certificate. Each course alone is going to cost $950, and for the entire micro certificate, it will be $2,850. And there are 3 deliveries in 2024. So when we say deliveries, we mean each delivery is all 3 courses. I mean, obviously they are staggered, so the next iteration for this micro credential program is next month. Next slide, please. So why we developed this program, as I mentioned a little bit about the upskilling aspect of it, there's an increasing computational capabilities, and recognize that it's important to improve the data literacy for many of you to capitalize on the potential. At least, when people talk about those concepts, what they are referring to. And longer term, we really want to build a community of practice in BC in the healthcare sector, so that people are competent and comfortable when it comes to concepts from data science, AI, and machine learning. But importantly, I think part of that competence may come from the fact that for many of you in your daily work, you might be enabled to say that, oh, this is an opportunity that maybe we could use, the data that we have to improve healthcare, work more effectively, and most important of all, to better patient care. So that really is the longer term vision of this micro credential program. So next slide, please. So one of our main goal is in designing this program was deliver the most current and relevant BC specific information. And so the first course, for example, is very specific to the data sources within BC. And so for that to happen, it's very critical that we partner with the active experts in the field who are leading the data science transformation within our BC healthcare ecosystem. And what is shown on these slides are the various organizations in the life sciences ecosystem that we work with. So as you could see, we have joined by instructors coming from 11 different healthcare organizations in BC. It's because we want to provide a very comprehensive picture of where we are at in terms of health data science provincially, and where we are headed, and how we align with our national counterparts across Canada. Next slide, please. So, who are the target audience? So this program is designed for students and professionals in the health sector. We want to provide practical knowledge and skills training in basic data analytics, but with a very BC focus, with a very BC specific context. We're hoping to upskill our learners, existing healthcare career, and allowing them to explore whether they could do a career transition with a career or jobs that are more data science or more data related, and so that they might be able to be more involved in data analytics, or at least making better decisions based on data. And so the design is hopefully that many of you could apply what you have learned from the program to your day-to-day work, and serve the patients and serve the healthcare sector in BC more effectively. Next slide, please. Now, having talked about who our target audience is, I also want to make a comment about what this program is not for. So our program is not designed to train professional data analysts. Our objective in developing this program is simply to equip healthcare providers, researchers, and administrators with some basic data science tools and knowledge. And so it's more about literacy, it's more about a basic level of competence, so that you could better communicate with analytics professionals and develop multidisciplinary collaborations based on data. So we want this program to be an introduction, so that if you like what you're hearing from this micro-credential program and you're interested in certain specialization within data science, for the interested learners, then you could pursue other opportunities. In our in BC, there are the more advanced analytics programs, formal degrees like Masters of Data Science, etc. That you might want to pursue them. But this is not a replacement of those programs. This is more like a kind of a feeder into that kind of more advanced formal degrees. So hopefully that helps you to understand the level of this program. Now, in the remaining time, we just very quickly go through the three courses and just say highlight a few things. So the first course is called Introduction to the Big Data Era. Is really a environment scan of what's happening in BC when it comes to BC's health data sets and the platforms, and at a very high level, the applications of data analytics when it comes to healthcare delivery and healthcare decision making. we use very specific examples to motivate concepts. The examples in cardiology is, for example, focusing in AI and computer vision and echo. We talk about natural language processing, how it's used for mental health. We talk about ambulance deployment when it comes to healthcare, operation. With those specific examples, the general message is to highlight the fact that we might have a specific problem in mind, and we want to be able to identify the right data sets to use and the appropriate analysis methods to use in order to solve that problem. So given the problem, we want you to be able to get to a point where you could do a little bit of matching in terms of finding the right data set and finding the right tools. In the second course, we dive a little bit into the data itself now, having seen the data source in the first course. So here in the second course, we want to visualize the data, and we are going to do some data storytelling. And when we're dealing with, for example, real-time operation and clinical data, they're often very messy, and we want to talk a little bit about how to make sure that we have the right data for the questions that we want to have answered. So we want to have the right data, but we also want to make sure that the right data is of high enough quality for the analysis in order for the analysis to be meaningful. There's really no point of analyzing, low quality data because it's garbage in, garbage out. So that's really the purpose of the second course. Now, finally, the last course, the third course, I think to some of you that might actually be the most fun stuff, where we are now really doing analytics, and we are using or introducing to you more advanced tools such as machine learning. There's a lot of hands-on platform we would like to introduce to the class. We'll be using this platform called Weka, which is a very intuitive, easy to use kind of entry-level machine learning toolkit that we want the class to be able to use some real examples and build some machine learning models, do some trend analysis, and then talk a little bit about the data in the clinical domain, and we say a little bit about NLP when it comes to text data. So and then we also want to talk about imaging. And so the third course is really a very breadth oriented discussion to introduce to you different categories of tools, imaging, text, machine learning, and the goal is to allow you to have some basic understanding of a wide collection of data science tools. So with that, I would like now to introduce Cynthia, who is one of our current students in the program. And Cynthia is a visual product designer working with the Strategic Initiatives Education and Development Division at BC Reno, which is a part of Provincial Health Services Authority, PHSA. As a designer who works in more planning, coordinating, and designing education and learning materials for kidney patients and healthcare professionals. So Cynthia has recently completed the UBC Health Data and Visualization course in July. So Cynthia, would you like to make a few comments about what you find and how the program has benefited your job?
Thank you so much, Raymond, for having me here to share some of my experience of this course. And as you said, I just recently completed the course 2, the Health Data and Visualization, and it's one of the 3 courses in this micro certificate. So it's really a good time for me to join this info session while everything is still fresh in my memory. I'll talk about my motivation for taking the program, my learning experience, how it changed my work practice, and day-to-day work, and some advice to share with those who are interested in taking this course. First of all, the motivation of taking this program. It was my manager who introduced this course to me. And at first, I was not quite sure whether this is a suitable course for me because, firstly, as a visual designer, I actually don't have any background in data science. And secondly, I wasn't very confident in my ability to handle the course. Then, however, after some investigations through the UBC website and watching their recorded info session video, just like what we're doing now, I thought this course could somehow allow me to take my first step towards learning how to look at data and then to analyze it more effectively and gain meaningful insights. And also, I think acquiring the data visual skills, visualization skills will be a valuable addition to my skill set, which will enable me to grow professionally. Therefore, I decided to take on the challenge to give it a try. And luckily, I had completed it. And then my learning experience would be the course 2 is a 5-week program. And in the first week of the program, I needed a little bit of time to get used to the online learning platform. And each week consisted of video lectures, short self-check quizzes, and online discussion, and one written assignment, and then the final project. The combination of the discussion and the quizzes varied depending on the module. Personally, I prefer the self-quizzes more because you have actually a second attempt if you don't get all the answers right on the first try. In this program, you will learn about like clinical data challenges, basics of data warehousing, concepts of statistical design, principles of effective visualization, communicating with data, and some ethical consideration. Overall, the content materials were pretty interesting and engaging, and I really enjoyed it. The assignment included simulated scenarios and real life cases in which we could apply the concepts we learned from the video lectures. I particularly like the communicating with data module because it's closely related to my work. In this module, I learned about how to distinguish between bad or good visuals and discover that data can really tell interesting stories. Understanding the principle of creating effective understanding the principle of creating effective visual provides a helpful guideline for my work practice. Having a deeper understanding of the data is beneficial for effectively and accurately communicating findings with stakeholders, making well-informed decisions, and making resources effectively. Before taking this course, I was totally unaware of how much the presentation of data visuals could actually influence decision-making. So it is such an important reminder for visual designers like me to be mindful of the impact of our work. Then how it changed my work practice. Part of my job is to transform complicated data into easy to understand infographics. Understanding the basics of data visualization helps ensure the data stays accurate and valid while I make the visuals look good. I firmly believe that aesthetic, impactful visuals and data accuracy can go hand in hand. As a visual designer, it's important to remember that accuracy is very important, but at the same time, I can make sure the data is correct when I make the visuals look good. So I think this is definitely the most important thing I took away from this course. And then my advice to all of you who would like to join this course is just do your due diligence and you should be fine. I think it is helpful to work on my assignments and require activities each week according to the suggested pace. In this way, I feel less stressed, not having to hand in everything at the final deadline. But of course, I understand that everyone has their own style and schedule, though. Lastly, as Raymond mentioned, don't forget to make use of the weekly Zoom sessions. It is a great opportunity to connect with your instructors. In my case, is Ulia and Daniel, and get any help you need from the course materials. And that would be all for my sharing, and I hope you find this useful. Thank you so much.
Oh, thank you, Cynthia, for providing your valuable perspective. I think you touch on quite a few aspects that some of the audience may resonate with. So this is really all we have for our presentation. For the remaining time, we'll address your question. I want to introduce you to Dr. Min Tai, who have been teaching the micro-credential program, for us. And so between she, Cynthia, Ulia, and Anila, I hope we'll be able to answer all the questions that you have. And the way to do this is put your question in the chat. And Ulia is going to monitor the chat and then bring up the questions. So while we are doing that, maybe I'll just come back with one question for you, Cynthia, that just in terms of the workload, do you think that is just about right, or is too much work, or maybe is not enough work? So maybe you could just comment very quickly on how you find the workload and how you're learning the material while you have your day job.
I think the workload is just about right, but since I don't really have any, as I mentioned, I don't have any knowledge about data science. I think at the beginning of the course, I took a little bit more time to kind of think about the assignment. But the writing part is just about right. I think every assignment, it requires only maybe 200 or 400 words at the max. So I think the written assignment was just about right. So I hope I can answer your question, but I think it's pretty okay, because I would particularly like at the end of the last week that we have the whole week to kind of complete our assignments. So I think that would be really great to have that kind of week to kind of focus on all those assignments, though.
Cynthia, one more question for you. How long did it take you to complete the projects?
To complete the project, it depends. The final projects, because it has more marks, and it has kind of like, it requires more words on it. So it took me more time for the final one. But the other ones, I don't think I needed a lot of time. But as I mentioned, like to do it like according to the suggested pace to complete your weekly assignments every week, then I think it would be more comfortable this way for myself.
I noticed that there's a lot of questions, but I think many of them are answered in the chat. But if any of you want to continue on that on certain topics, feel free to continue to type or maybe unmute yourself, and then we could discuss further.
Shall we stop sharing screen?
There is a question in the chat. What is the regular lecture time on Zoom? For most of the courses, our Zoom sessions are on Thursday from 6 to 7 p.m. Pacific time. And Mint, can you please remind me what you did for course 1?
Yeah, so for course 1, which is the course that I'm the instructor for, the Zoom sessions is 6 to 7 p.m. on Monday, so Monday evenings.
And then I think from what I know, the participation for the synchronous sessions were quite high, right?
I think there's a question around whether or not the sessions are recorded in case you were working. Yep, they are.
I would say for course 2 and 3, we, for example, this term we have not recorded the session just because some students expressed that they want to be more private ones. But for courses 2 and 3, I would say our sessions is more like Q&A. So there were no new content introduced in the office hours in that sense. So there were like first round of the course offering, we recorded them, but then the students just asked not record them. So I guess it all depends on the student preference during the course. Mint, I guess, can you help me too? And I will comment later. So one of the questions tag, what types of health data set will be covered in the courses?
Yeah, so in course 1, I think I responded to one of the questions there that you're not actually expected to access the data. It's more, we talk a lot about, Population Data BC, the health data platform, and, ways in which you could access the data depending on, what kind of affiliations you have. And most of the data that we discuss are health administrative data, so hospitalization data from the discharge abstract database, medical physician billing data, PharmaNet data. There are some, there's a lecture that talks about the BC Cancer Registry, and I'm trying to think. There's a lecture that talks about some of the laboratory data that could potentially be accessible. So it ranges, and it's not, we definitely don't capture everything. There are nuances, and there's, specific data sets that some people are more interested in that, can be explored as well, but aren't covered in the talks that are given in the video lectures.
And for course 3, we use the open source data set from for health data from UCI machine learning repository. I will leave a link here.
I think you can use your professional development funds for this course. I think that's a legitimate expense. And then I think the office hours are to function as tutoring sessions if they have questions. Is that right, Mint?
Yeah, for course one, I can speak to course one. The synchronous, so the live Zoom session, we often use sometimes if folks want to stay afterwards, we'll turn off the recording and we can have one-on-one sessions. And then, myself and the TA have also made ourselves available like on appointment if people just want to chat about their capstone project and things like that.
Yulia, there's a few questions for you in the chat.
I was answering more questions. Just one second.
I think there's also the question of whether someone should actually register all 3 courses now, just in case the courses will fill up. But this actually leads me to the following question. I actually don't know the answer. What is actually the cancellation policy when it comes to people registering the course and then they need to cancel? I think we have defined that in the past, but I don't honestly know what the current cancellation policy is. Maybe Diane or Steph could answer that.
I don't have the answer right now, but I know Neha Shivar from Excel is on this meeting. Maybe she could help, or we'll find that information and send it to the attendees after.
Yeah.
If it's not on the website.
I can comment based on past experience. We have one case. We didn't have many cancellations, to be honest. But in one case, one student was allowed to take the next iteration of the course because due to some circumstances, they only take like, I don't know, week 1 of the course. So they were just transferred to the next offering.
I was just going to say for Dr. Cernick, if it really depends on your schedule, in terms of you signing up for all 3 courses. So the other piece is that this is recurring. So you might be able to do, your schedule may allow you to do course 1, but then the dates for course 2 don't fit you. You could also sign up later for course 2. So I think we're trying to have flexibility because we recognize people are working and you may not have at each time of the year a similar schedule. So I think there is flexibility.
So in terms of the question of whether you need to take the courses 1, 2, 3 in that order, the answer is no. You could take it in any order, but if you intend to take all 3 courses, I think it will be easier if you take that in that order. But if you want to jump around first and then decide, for various reasons, timing or tuition, then feel free to go to course 3 before course 2 and then also before course 1. So it's very flexible. We don't assume in the design of the curriculum, we don't actually assume any prior prerequisite knowledge.
I wonder if Neha could answer the question around the tuition waiver benefit for this course. I'm not sure if it's eligible. I don't know the answer to that.
Yes, Dr. Anita, students are eligible for, they can apply for waiver and we can process their waivers for it.
Perfect. Thank you.
Thank you.
Oh, thanks for sharing our policy, Julian. And you don't need to know Python?
No.
Course 1 starts September 3rd.
A tuition, I'll just answer for Ryan. The tuition waiver benefit is something if you are faculty or staff at UBC, you get, it's part of your benefit package. So I think each course is at $950. Is that what?
Yeah. So each one is
$950. Yeah.
$950, and all three is $2,850.
Yeah. So Mint, do you want to answer if it's okay if one misses one or two lectures, how you would suggest the students respond, like deal with that?
Yeah, so for the live Zoom sessions, they're optional. They're highly encouraged, but optional because everybody has different schedules and things like that. In terms of so the way course one is organized is, after every lesson, which is a 20 to 30-minute lecture, there are really quick self-check quizzes, as Cynthia mentioned. And if you miss a couple of them, it's not going to impact your final grade all that much. It is a pass-fail course. And so, the videos can be watched at any time. There are, for the quizzes, I think based off of some of the feedback that we received earlier, we've made some of the deadlines for things a little bit flexible. And so, we're trying to balance the need for, folks being able to do it at, their own pace, but also, because this is an online format, trying to encourage engagement within an online platform. So, if you missed a couple and needed to, or watch the videos after the, whatever due date, it's not the end of the world. And, in another sense, we also tried, if you do need an extension, as long as you bring it forward to the TA and myself for course one, we're happy to accommodate to a certain extent, as long as that's kind of, decided on before the actual due date. So trying to keep things flexible.
I think Wendy had a question around the data sets that are being used are US. So for people who are interested, so I think there's a big overview of what the BC Health data assets are. So we do go into some detail in the course around that. So just so that I think would be helpful. And just to answer, Aine, I think had the same question, what is unique to the BC specific content is looking at what are our data assets that we have, and some of the dashboard and quality, the work in terms of using data science, they're examples from real world in BC in our health system. Is that fair, Mint? Yeah.
Yeah, in course one, we only talk about BC data sets.
So I think the question about employment opportunities you might have after taking this course. So I think it's important to say we're not necessarily giving you computational skills, but I think if you are in the health system, if you're in health administration or working, I think it is you'll have knowledge and skills that would allow you to work better in the health system to improve on any initiatives on quality, any technical communication. And like Cynthia was saying, particularly around data visualization in a domain area. (2025), not 2025, but that is a real future that we're going to be in. Yeah. I don't think the course is going to be offered in 2020. Yeah. That's it'd be amazing if it had that sustainability, but I don't even know what's going to be there in the future.
I'm just future thinking.
Yeah, very future thinking. So I tried to answer it to say, I can't tell you what the employment opportunities are. This isn't like a professional certification, but the intention was to improve people's literacy skills in this space that increasingly data science is being used in health, and just trying to get people to understand the concepts and to start thinking about it, so that they can communicate with people who are doing analytics and asking questions. And like Cynthia mentioned, the importance of data visualization. And, we have to make compelling asks, and sometimes we can leverage the data that we have to help people understand the situation that we face and come up with better solutions.
I would also add to, in terms of applicability, I think BC has a very unique data, not only are the data sets unique, but also the way folks can access data are unique. And so, this course is, trying to practically walk someone through how you would access data in BC. But all that to say is that, there's tons of work being done across the country with very similar data sets. So for example, one of the ways that folks can access data in BC is through Population Data BC. There's kind of a similar counterpart in almost every province across the country. And even though data sets might differ certain ways, there, a lot of researchers and other folks have been doing a lot of work, like national work using, for example, the discharge abstract database on hospitalizations is available across the country in every province. So if you were to use that data set in BC, you would get access or be more familiar with what types of variables are available in that data set, and potentially apply that across the country. I think access in the States and elsewhere is a little bit different in terms of what data is available, but at least across the country is somewhat similar.
So maybe I'll also add that I have been doing, as a computer scientist, I've been doing all kinds of biomedical research for over 25 years. And I think over the past few years since the pandemic, I think that the province, Ministry of Health and PHSA, the Provincial Health Services Authority, and then trickle down to the health authorities, I think has become a lot more welcoming in terms of health data science opportunities. You could Google this. I think the Ministry of Health, for example, has recently launched is it called a Health Innovation Hub? I think that is what it's called, and is really trying to bring innovation into our healthcare system by using data. And then the Ministry of Health and PHSA itself is opening up a lot of the data sets for researchers, for healthcare professionals to use. So I think that just the general trend that this area of health data science, I think, is not going to go away, and if anything is going to expand further. And so I think that's very unique. As far as I know, there's actually BC is quite a leader within Canada, and that to some extent tie back to the question about employment opportunities. I think that the employment opportunities are expanding, even though some of those jobs may not actually have been created today. But I think as the whole ecosystem start to understand what can be done with the data, and there are more and more people able to harness the data, I think you will see those job opportunities created and actually opening up.
Maybe I'll answer this last question. I know we're up on time, but is large epidemiology data sets in the courses. Such data sets usually require high-level stats knowledge. Yeah, so, we do use a lot of health, population level health data health administrative data sets in the course. But, the idea, at least in course 1, is, I feel like we can have a whole course on one data set. And so, it's really meant to give you an overview of what data sets are available, and then kind of introduce the idea of, how do you develop, a relevant, clinical research question, like what things you have to think about with certain data sets. And the capstone project isn't meant for you to actually you don't need to have a lot of statistical knowledge or theory behind it. We understand that involves probably a large team of, multidisciplinary folks to actually, follow through on. And so, we recognize that these data sets do require high level stats knowledge, but we're just introducing the topic to you. And then, if you are going to pursue that capstone further, then, I think more conversations need to be had with the team and things like that to actually execute.
So I think we're at the end of our time, and thank you so much for all of the great questions. And this will be recorded, so you can look back if you want to see any of the answers again. And I hope some of you will join us in taking the course. I know Mint would be excited to have you as a student, and we really appreciate the questions and the time. And thank you so much, Cynthia, for sharing your experience. I think it's very valuable to have
Thank you.
a student do that. And thank you, Yulia and Raymond, for also presenting and answering questions. Really appreciate it. Okay.
I just want to add that if you have questions, this is not your last chance.
Yes.
I think you could contact us, and we'll be able to provide the answers to you. So,
Yeah, absolutely. Okay.
thank you. Bye.
Bye,
Have a nice
everybody.
day.